The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Hello everyone, this is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. After the last episode that was aired on March 29th, 2025, in which I spoke about my friend who did research to advocate for her healthcare, it was brought to my attention by my husband and a faithful listener that it would have been helpful to hear how to do reliable research. They are absolutely right. I definitely missed the mark on that one. First of all, I should have mentioned that my friend I talked about in that episode has experience in the medical field, so she knows how to find reliable health info. Also, here are a couple of research tips. In general, you'll find good health information on websites that are run by federal government agencies. These are sites that end in .gov, .gov. Medical schools or large medical facilities, for example, Cleveland Clinic Health Library or Mayo Clinic Diseases and Conditions. Large professional or nonprofit organizations are also excellent resources. For example, the American College of Cardiology, American Heart Association, or American Cancer Society. Another site that provides evidence-based information that is very user-friendly is Healthline at healthline.com. Do not trust information on a site if they don't use up-to-date research on the subject, or if they're promising some unbelievable, too good to be true cure for a disease or problem, or if they have lots of ads, or if they're making a sales pitch, or if their writing is very dramatic and emotional. My apologies, and now on to today's episode. As many of you know, for the first 20 years of my adult life, I made my living as an opera singer. Then I spent 22 years practicing medicine as a nurse practitioner. And during my years in family practice, I became what many people would call an expert in hormone balance and hormone replacement. So it wasn't until this second part of my life, the medical part, that I made the connection that hormones really affect our singing voice. What a revelation that was. I should have figured that out earlier. I just gave a lecture to graduate students who are at the University of Tennessee in the opera program, and I titled it Hormones and High Notes. I know that not all of my listeners are professional singers, but I thought you might like to know how our hormones affect our voice production. We need to start by understanding what is going on with the hormones when they're cycling, and we need to know something about how hormones are supposed to cycle. I will be referring to cycle days, so it's important to know that cycle day 1 is the first day of menstrual flow. Knowing how this whole thing works will help you understand the job of female hormones and how they are supposed to be balanced. Let's start with the follicular phase. During the follicular phase of the cycle, which is the first half of the cycle, several small sacs, or follicles we call them, form in the ovary. A dominant follicle forms that's bigger than all the other follicles, and an egg matures inside it. All the other follicles shrink and eventually disappear. During this phase, estrogen is the dominant hormone, and if hormones are well balanced, it is in the second week of this follicular phase when women tend to feel their best. Women will often say, "This is when I feel like my normal self, happy, healthy, well-adjusted, and in balance." Then we move on to the ovulation phase. On around cycle day 15, a pituitary hormone called luteinizing hormone causes the dominant follicle to release that egg. It takes anywhere from 1 to 2 days for the egg to leave the follicle. During this time, some people have ovulatory pain, which we call Mittelschmerz, which is German for middle pain. The last half of the monthly cycle is the luteal phase, which lasts for about 14 days. After the egg has left the follicle, a mini organ called the corpus luteum starts to form from the site of ovulation. Your corpus luteum produces progesterone. Making progesterone is the corpus luteum's most important job. Progesterone becomes the dominant hormone during this phase, or it's supposed to be anyway. And if an imbalance occurs of wimpy progesterone levels or too high estrogen levels or both, women tend to feel terrible and often refer to this as hell week or 2 weeks of hell. This is when we can see some significant vocal changes, which I'll talk about a little later. During this phase, some of you may experience fatigue and feel quite weepy and emotional. You may also have severe fatigue, sudden bouts of weakness, or feeling like you're going to pass out. Breast swelling and tenderness and craving junk food can also occur. Anxiety and panic attacks, along with extreme irritability, can also be present. Research has shown that around 75 to 80% of reproductive age women have these kinds of symptoms during the luteal phase. So, you are not in the minority. You are in the majority if you're experiencing these symptoms. When someone isn't having a regular cycle, they're not having regular periods like those people who have PCOS, polycystic ovarian syndrome, the person doesn't typically ovulate. So guess what? No ovulation, no corpus luteum forms, and no progesterone is secreted. And even those women who are ovulating may develop a corpus luteum that isn't very good at secreting progesterone. The levels of progesterone are low, while at the same time our ovaries are still chunking out plenty of estrogen. And in addition to the ovaries, we have other estrogen sources. Our fat cells and our adrenal glands are also making estrogen. The balance of progesterone and estrogen is important. When they aren't balanced, meaning progesterone is too low and estrogen is too high, we can develop something called estrogen dominance, a hormonal imbalance that can affect singing. All hormones, including sex hormones, thyroid hormones, adrenal hormones, and insulin, regulate every cell in our body. Our cells have receptors on them for each hormone, and when a hormone attaches to that cellular receptor, it changes the behavior or the metabolism of the cell. Receptors for sex hormones have been found on the vocal folds, which we also call vocal cords, suggesting a link between hormone levels and vocal fold function, which can cause changes in voice production. A 2017 study investigated the quality of women's voices in different phases of the cycle. They compared those who have natural periods that aren't influenced by outside hormones, to those who have the kind of hormonal contraception that gives you the same amount of hormone daily. In this study, they collected voice samples of 44 women who had natural cycles. The samples were collected during 2 phases, the late follicular phase, this is the second week in the cycle when women typically feel good, and the luteal phase, the time in the cycle when PMS often occurs. They also collected samples from 20 women who were hormonal contraceptive users. The samples were taken during the 6th through the 12th day of the month and the 16th through the 28th day of the month. Results showed that voices of naturally cycling women had a higher minimum pitch in the late follicular phase, that first part of the cycle, compared with other phases. So, if that's the case, singing high notes would be easier during this time frame. Interestingly, as I explained earlier, this is also the week of the month during which women will often say that they feel like their normal self, happy, healthy, well-adjusted, and in balance. It was also noted in the study that during the late follicular phase, there was an increase in mucus in the laryngeal mucosa and increased mucus production on the vocal folds compared to the luteal phase, during which there was a drying of the laryngeal mucosa. These changes in the moistness of the vocal folds can also impact vocal production. The amount of health and medicine research done on women compared to men is really sort of pathetic, but someone has bothered to do research on and I'm doing air quotes here, attractiveness of the female voice. They measured the attractiveness of the female voice throughout the menstrual cycle. Not sure who dreamed up that study, but it is true that research has revealed that attractiveness ratings of women's voices varied across the menstrual cycle. So sometimes you may have a very attractive voice, and sometimes you have a screeching, horrible voice. No, it's usually not that dramatic. Anyway, those who were rating the voices found that voices recorded in the fertile phase, that late follicular phase, the good week, were found to be most attractive, and lowest ratings were given for voices recorded in the menstrual phase or the luteal phase, the PMS phase. The researchers theorize that the female voice becomes more attractive during the ovulatory phase as nature's way of increasing the chances that mating will occur during this time. You have probably noted that during the luteal phase, the last half of the cycle, I talked about two seemingly different things: PMS symptoms and unfavorable vocal changes. But they can certainly be and most likely are related. One of the many symptoms that can occur during this phase in the cycle, the luteal phase, the PMS phase, is water retention. When we retain fluid in our body related to hormone changes, it typically impacts every part of our body, including our vocal folds or vocal cords, which can make them thicker, which of course can impact our singing. Thick vocal cords are harder to move, which makes it harder to sing, I can tell you personally. This phenomenon is called dysphonia premenstrualis. I love this term, dysphonia premenstrualis. It sounds so wonderful, and it isn't. Anyway, it literally means premenstrual abnormal voice, when the voice can be described as hoarse, rough, raspy, strained, weak, breathy, or gravelly. According to a 2016 study, the most common symptoms of dysphonia menstrualis, can you tell I like saying that, are difficulty singing high notes, decreased vocal flexibility, huskiness, fuzziness, breathiness, decreased volume, difficulty bridging passagios. And passaggio is a break between the lower and higher areas of the voice. So we have difficulty bridging those two areas. And intonation problems. We'd end up with pitch problems. Not too many problems, really. Just a fairly long list. I remember very well struggling through these issues when I was singing professionally. Dysphonia goes hand in hand with PMS, premenstrual syndrome, and PMS is typically caused by estrogen dominance. So why we get estrogen dominance and what do we do about it is up next after this break, so please stay with me. What puts us at increased risk for developing estrogen dominance? Having anovulatory cycles. This is when we don't ovulate during a cycle. Again, after we ovulate, a mini organ called the corpus luteum forms at the site of ovulation, and that mini organ secretes progesterone. So, if you do not ovulate, you do not make progesterone this month. This commonly happens in women with PCOS and perimenopausal women. Excess body fat. Our fat cells produce estrogen, so the more fat cells we have, the more estrogen we produce. Chronic stress. This causes increased cortisol secretion from the adrenal gland, which leads to hormone imbalances. A diet low in fiber, high in refined carbohydrates, and low in high-quality nutritious foods like fresh fruits, fresh vegetables, and good fats from foods like nuts and avocados. This will set the stage for estrogen-progesterone imbalance. Poor immune function. Supporting your immune system is very important for this and for so many other reasons. We've talked about this endlessly on this podcast. Environmental agents like mineral oils or petroleum products that can act like estrogen in our body. These are called xenoestrogens. Using skincare products or makeup that contain mineral oil, or drinking out of plastic containers, or heating up food in plastic containers allows xenoestrogens to enter your body. Estrogen and progestin containing birth control options can cause estrogen dominance, but you won't have the up and down female hormones, which I'll discuss later. Some of the symptoms, and there are a lot, of estrogen dominance, and I'm going to try to go through them quickly. Irritability, weight gain, especially around the hips and waist, difficulty losing weight, bloating, fluid retention, brain fog, anxiety, blue mood. It continues here. Poor sleep patterns, mostly trouble staying asleep, fatigue or exhaustion, decrease in physical stamina, hair loss, skin changes including acne, quickly aging skin, and or dry skin, low motivation or apathy, low sex drive. For those who are still having natural periods, you can have additional estrogen dominant symptoms that include heavy periods, irregular bleeding, increased cramping, longer period flow. You can also have worsening PMS, which can include mood swings and fatigue, increased breast pain. You can feel good only 1 week of the month, the week that we talked about earlier, worsening ovulatory pain, worsening or new migraines. And some of the disease processes versus symptoms, these are disease processes, not symptoms, that can occur because of estrogen dominance include ovarian cysts, uterine fibroids, fibrocystic breast disease, endometriosis, and infertility. These diseases can develop when someone is estrogen dominant because estradiol, the estrogen that comes from our ovaries, and estrone, the estrogen that is produced by our fat cells, are stimulatory. They stimulate the growth of cells in the female sex organs, and progesterone slows the growth of cells in the female sex organs. So when estrogen levels are high and progesterone levels are low, we get overgrowth of tissues, which can present as cysts, fibroids, and thickened lining of the uterus. There are conventional treatment methods used to address the symptoms that develop due to estrogen dominance. For acne, we use topical prescriptions like Retin-A and benzocaine. We also use hormonal contraceptives and Accutane. For bloating, prescription water pills called diuretics are often used. For mood changes, antidepressants and cognitive behavioral therapy are often recommended. For hot flashes, sometimes hormonal contraceptives are used, whether or not you need birth control. However, sometimes people get hot flashes when they use birth control, hormonal birth control. For sleep disturbances, prescription sleep meds, including Ambien, sedative antidepressants, and benzodiazepines like Xanax, are often prescribed. For headaches, prescriptions like Imitrex, beta blockers, tricyclic antidepressants, Botox injections, and CGRP injectables are used. And for sex drive, Viagra can be prescribed. Yes, it can be prescribed for women. There are other ways to reverse or prevent estrogen dominance other than the prescription options I just listed. Most of these recommendations are also made for general wellness. Increasing exercise promotes hormone balance and reduces body fat. Eat nutritious foods like fresh fruits and vegetables and good fats. Also, increase your fiber in your diet. Adequate fiber in your diet allows for improved elimination of stool. Estrogen is excreted by the bowel. If stool remains in the bowel, estrogen will be reabsorbed into the body. Reduce stress. I know this is not an easy task, but if you have stress in your life, and I'm not sure I know anyone who doesn't have stress, it is so important to find your way of managing it. Avoid use of mineral oils and petroleum products in your hair care and skincare because they act like estrogens in your body. I discussed this earlier. They are called xenoestrogens. Xenoestrogens can also be leached into your food if you heat it in plastic containers in the microwave. This can also happen when light filters through clear plastic water bottles. So use a stainless steel water bottle instead and fill it with filtered water. Consider adding over-the-counter supplements like DIM, diindolylmethane, or milk thistle, which aids in hormone balance by supporting the body's metabolism of excess estrogen, and I'll talk about some options later. Detoxify the liver. The liver is our body's filter and filters out excess estrogen, so keep this organ healthy by limiting alcohol and avoiding high-fat foods. Milk thistle caps can aid supporting a healthy liver and clears estrogen from the liver. However, if you have grass allergies or hay fever, this may not be the best option for you. DIM would be a better choice for you. Consider starting a balanced bioidentical hormone regimen that includes progesterone, and bioidentical hormones are hormones that are identical to what your body produces. Progesterone helps the body release extra fluid, so it balances the water retention that estrogen can cause. Progesterone typically requires a prescription, but there are progesterone creams that can be purchased over the counter. However, it is best to have a provider knowledgeable in progesterone dosing guide you in the use of this product, whether it's prescription or over the counter. In order to address estrogen dominance, it can be helpful to begin a supplement that improves our estrogen metabolism, meaning that it helps clear extra estrogen from your body. There are a couple of options, but let's just start by talking about DIM, diindolylmethane. This is a phytochemical, a plant-based chemical that comes from cruciferous vegetables like broccoli or cabbage. Brands like Life Extension, Nature's Way, Source Naturals, and Pure Encapsulations have good DIM products, and some of those products also have additional ingredients to aid absorption. There are also liquid forms of DIM if you have trouble taking pills or you want to start at a lower dose and work up to the recommended dosing. You will commonly see indole 3-carbinol combined with DIM supplements. Indole 3-carbinol is a phytochemical also found in cruciferous vegetables such as cabbage. It shows great potential in preventing cancer, especially hormone-related cancers such as breast and prostate. Abbreviated as I3C, it is now available as a supplement. I3C is popular both as an antioxidant and as a cancer fighter. Research on I3C dates back to the 1960s when it was investigated for its actions against chemical carcinogens. Since that time, researchers have been able to show that I3C has powerful and diverse ways of stopping cancer. It is a precursor to DIM, meaning that once in the gut, indole 3-carbinol breaks down and forms DIM. Vite Immune, that's VIT Immune brand supplement, is an example of indole 3-carbinol combined with DIM. The dosing is 2 caps once daily. Milk thistle is another option to help with estrogen metabolism. One advantage of using milk thistle versus DIM is that most milk thistle products are single ingredient products. So if you don't want to have a combination product, one that has a lot of things in it, this can be a good choice. Again, I do not recommend this option to anyone who has grass allergies or hay fever. If you have this type of allergy, it's best to stick with DIM for estrogen metabolism. Companies like Life Extension and Puritan's Pride have reliable milk thistle products. Recommended milk thistle dosing is usually around 250 milligrams twice a day, and the milligrams per cap really varies from brand to brand, so follow the directions on the bottle. It's usually 1 cap twice daily for most products. Men can have too much estrogen too. How the heck does that happen? Well, many of the same ways it happens in women. Diet. Our diet has a direct effect on estrogen production in the body. So eating a diet high in refined carbs triggers excess fat storage, and fat cells secrete estrone, one form of estrogen. Estrogen tells our body to store more fat. So the estrogen secreting fat cells just create more estrogen secreting fat cells. When we have chronic stress, our body secretes cortisol from our adrenal glands. And when cortisol levels are up, testosterone levels go down in men and estrogen levels soar. Again, mindful stress management is so important. Xenoestrogens are also problematic for men since they act like estrogen in our body. And I've reviewed with you how to avoid xenoestrogens earlier in the episode. And symptoms of estrogen dominance in men are often very similar to those that women have. The irritability, weight gain, for them especially around the waist, difficulty losing weight, bloating, fluid retention, brain fog, anxiety, blue mood, poor sleep patterns, fatigue, decrease in physical stamina, hair loss, skin changes, low motivation, apathy, low sex drive. These can all happen when men have estrogen dominance. Men can see changes in their vocal production if they're dealing with estrogen dominance. They won't usually happen in a cyclic way, but it could change day to day depending on what's happening in that person's life. So we can do the same kinds of things to eliminate estrogen dominance in men. Reduce or eliminate refined carbohydrates. Work to reduce fat by increasing exercise and changing diet. Implement mindful stress reduction techniques. Avoid xenoestrogens. Start a supplement that aids estrogen metabolism like DIM or milk thistle. And back to women, in that 2017 study I talked about earlier, in contrast to the women in the study with a natural cycle, there were no voice changes across the cycle in hormonal contraceptive users. Hormonal birth control can help with symptoms we can have with our body's own fluctuating hormones during our monthly cycle. Hormonal birth control shuts down ovulation from the ovaries. That's the whole point. And in doing so, you do not produce any of your own hormones. That being said, some estrogen and testosterone can be produced by your adrenal glands, but that doesn't happen in a cyclic way. A literature review in a 2016 Journal of Voice article was done on the effects of hormonal contraception on the voice. A total of 24 articles were available for review, and back when I was singing professionally, contraception was believed to affect the voice negatively. And it often did have a negative impact because the estrogen doses at that time in birth control was so high. We didn't have low dose options. Recent studies using low-dose oral contraceptive pills show that they stabilize the voice. It was noted that vocal stabilization occurred only during sustained vowel production. There appeared to be no benefit seen in regular patterned speech. Because of the sustained vowel production benefit, singers may be the only population that have increased vocal stability as a result of taking hormonal contraceptives. The only type of birth control that has been studied are oral contraceptives that contain both ethinyl estradiol and progestin, which is a synthetic form of progesterone. Other forms of hormonal contraception have not been evaluated for effects on the voice. I had many patients who couldn't tolerate hormonal contraception due to side effects, so that may not be an option for you if you are a singer and wanting to have a more stable voice. Here's the bottom line. If you are having regular periods without significant PMS or dysphonia premenstrualis, or if you are on hormonal contraception and you have no medication side effects and no vocal problems, or you are a man who has no estrogen dominant symptoms or vocal issues, y'all are good to go. Keep doing what you're doing. Singers find ways to deal with vocal changes that occur premenstrually, mainly by solidifying an excellent vocal technique through voice lessons and lots of practice. singers do whatever they can to address the problem, because when you have to sing, you have to sing. So I figured it out, and countless other singers have found a way to do their best singing in spite of hormonal changes. So, if you are having estrogen dominant symptoms, especially if those symptoms include vocal problems and or premenstrual symptoms, and the symptoms are impacting how you function in your daily life or how you function as a singer, consider making the lifestyle changes I reviewed and starting a supplement that helps with estrogen metabolism to balance your own hormones and correct estrogen dominance. Thank you all for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really do matter. Also, make sure you follow the show so that it will be automatically downloaded. That matters too. I encourage you to visit our Facebook page, INB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On our Facebook page and website, we have the information about how to schedule an appointment with me so we can chat about how my perimenopause course can help you if you are going through this phase in life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you, Forrest. Everyone, remember, your health is in your hands.